Good afternoon. Thank you all for being here for today's press conference. I'm joined by our Health Commissioner, Dr. Jaraza, and Police Commissioner, Michael Harrison. We are here today to review Baltimore City's current COVID-19 mandates. Last week, Dr. Jaraza and I announced the city will relax capacity restrictions in alignment with the new state of Maryland order. That means we are at 100% capacity. Those updates took effect on Saturday, May 15th. There's one area in which Baltimore City differs from the state of Maryland order, and that's in regard to masking. Until the city reaches a high level of vaccination, you're required to wear masks indoors and outdoor venues in Baltimore City. Let me repeat, indoor masking and masking in outdoor venues will be required. While our mask mandate is still in place, capacity restrictions for both indoor and outdoor establishments and venues have been completely lifted. If you are not vaccinated, it is strongly encouraged that you continue to wear your mask. If you are not vaccinated, it is strongly encouraged that you continue to wear your mask. As of today, Baltimore City has hit a significant milestone with 33% of city residents 16 and older being fully vaccinated, but this means 2 out of 3 people you pass on the street are not yet vaccinated. We continue to encourage all Baltimore City residents age 12 and up to do your part and get vaccinated as soon as possible. You can go to covax.baltimorecity.gov to find an appointment. That's covax, covax.baltimorecity.gov to find an appointment near you. This is about protecting yourselves and those around you. And though we are continuing on this trend of recovery, we must continue to use common sense and take the pandemic seriously. I will now turn it over to Dr. Jaraza for further remarks. Dr. D.
Good afternoon, and thank you, Mayor Scott, for your continued and steady leadership. To review our latest case data, we're seeing some marked improvement from our recent highs. Our daily new case count is approximately 97 new cases per day, a decrease of 63% from 4 weeks ago. To date, there have been a total of 52,293 confirmed COVID cases in Baltimore City. 973 Baltimore City residents have lost their lives to COVID, and we are now averaging close to 3 deaths per day. Our current percent positivity is 2.4%, a 53% decrease from 4 weeks ago. Our intensive care unit and acute care unit capacity have both decreased and are holding at 84%, respectively. As Mayor Scott indicated, effective this past Saturday, May 15th, Baltimore City has relaxed capacity restrictions for businesses in alignment with the new state of Maryland order. However, in a departure from the state's order, Baltimore is maintaining its local mask mandate with an updated health order requiring all residents and visitors to Baltimore businesses to continue wearing masks while indoors and at outdoor venues, including stadiums. This order includes children over the age of 5 unless there is a health reason that prohibits safely wearing a mask indoors. Just to confirm, masking is no longer required outdoors except at outdoor venues. It is strongly advised that individuals not vaccinated continue wearing masks around others. The CDC's recent change in masking guidance allowing fully vaccinated individuals to remove their masks indoors and outdoors is a triumph of science and underscores the importance of vaccinations. This shift in guidance is indicative of the ability of the approved vaccines to reduce the chances of significant illness from COVID and also increasingly to limit the spread of the novel coronavirus. We see this updated guidance as a clear sign that all eligible residents should get vaccinated as quickly as possible in order to return our city and country to pre-pandemic levels of normalcy. At the same time, realities on the ground make it difficult for Baltimore City to immediately follow suit in removing our local indoor mask mandate. As of today, while 42% of adult residents over the age of 18 have received at least 1 dose of vaccine, and 33% of all residents are fully vaccinated, that still means the majority of Baltimoreans remain vulnerable to the deadly effects of the novel coronavirus. Additionally, the CDC's announcement regarding vaccines comes at a time where robust methods to confirm whether individuals are vaccinated do not yet exist. In practice, every Baltimore resident should continue to bring a mask with them whenever they leave their home, carrying one in their purse or bag or on their sleeve where it is easily accessible, even when not in use. When you're walking down the street or at a park outdoors, and able to maintain social distance, wearing a mask isn't necessary. But when you enter a business, use public transportation, or you pick up your children from school, you should be wearing a mask. Masking works, and it's been proven to reduce the spread of COVID-19. Public health experts agree that disease transmission is much more likely in indoor spaces, especially when masks aren't worn. At this time, Baltimore City will be maintaining an indoor mask mandate until at least 65% of adults have received at least their first or only vaccine dose. Equitably vaccinating residents remains the best way to lift our local mask mandates and return to normal. Baltimore City Health Department staff and clinical partners continue to bring vaccines directly to communities who need them at mobile and pop-up clinics. Alongside the Baltimore City Fire Department, the city launched a door-to-door vaccination campaign serving our homebound residents last week. We also continue to support peer-to-peer conversations about the safety and efficacy of vaccines via Health Department-trained value vaccine ambassadors. These local community members encourage residents to ask questions and provide answers about vaccine safety. It has never been easier to get vaccinated. We encourage residents to register for a vaccine at the Baltimore City Health Department Vaccine Clinic by visiting covax.baltimorecity.gov or by calling our COVID call center at 443-984-8650. This line is available Monday through Friday from 8:30 a.m. to 6:30 p.m. and Saturdays from 9 a.m. to 1 p.m. Additionally, those 12 and older can seek Pfizer vaccine appointments with the University of Maryland, Baltimore, which has set up a direct COVID-19 vaccine appointment website at getthevaccinebaltimore.org. Many mass vaccination sites operated by the Maryland Department of Health also provide Pfizer vaccines, and more information can be found at massvax.maryland.gov. Local pharmacies and clinical partners are also providing vaccines, and residents can enter their address to find local vaccine clinics on the Maryland Department of Health's vaccine site locator, which can be found at coronavirus.maryland.gov. Shifting gears for just a moment, today also marks the beginning of Code Red extreme heat season in Baltimore, a multi-agency effort to address the impacts of extreme heat on residents in Baltimore City. As a reminder, the Code Red extreme heat alert will be issued by the Health Commissioner when the forecasted heat index, a measure of air temperature and relative humidity that indicate how hot it feels outside, is greater than or equal to 105 degrees Fahrenheit. When this occurs, staff from several city agencies, including the Office of Emergency Management and the Health Department, will coordinate the opening of cooling centers around the city that offer an air-conditioned space and water for residents without access to cool air within their homes. All city cooling centers will modify their operations this summer to encourage social distancing. Locations and times will be announced at the time of the Code Red Extreme Heat Declaration, and an updated list of cooling centers will be posted on the Health Department's website throughout the summer. Residents may also call 311 for more information on what cooling centers are open. Now more than ever, we can win the fight against COVID. Baltimore, we're counting on you now to get vaccinated so we can return to pre-pandemic normalcy. It's Baltimore against COVID, and we'll win this together. Thank you.
Thank you, Dr. Raza. And Baltimore would not be where we are today in terms of recovery with the tremendous work and without the tremendous work of Dr. DeRosa and the entire Baltimore City Health Department. So we owe all of them a debt of gratitude. It's been a long journey, but we are finally approaching the light at the end of the tunnel. But we must remain strong and smart as we continue to fight our way to the end of this pandemic. And with that, we'll take some questions.
Mayor, and maybe the health commissioner as well, what are some of the pockets of people who you are having trouble reaching, and how are you going to get to that, 65% where we can, take off our masks indoors? What are some of the issues that you're having reaching more of the population?
So at the beginning, when we were planning for vaccination, we created something called value communities, which were focused on particular groups of people that we know might be harder to reach. So this includes our Latinx population, older adults, individuals that are African American, pediatric population, so a handful of these groups. And so we have individuals who are signed as liaisons for those groups. If you look at our website, we actually have this information of what parts of the city have more vaccination coverage than others. And I don't necessarily know that there's one particular group that's been harder to reach. I just think we have to ensure that we're providing access and doing it in an equitable way. And as great as our mass vaccination sites are, we know that they're stationary, they're fixed, they have fixed hours. And so we've really tried to create a strategy that involves bringing the vaccine to people. So that will be our mobile vaccine clinics, as well as all of the work we did around going to senior housing sites. So really starting with our most vulnerable population first. So again, I don't know that there's a particular pocket. We see varying levels of coverage across the city. And I will say, unfortunately, it mimics what we see in terms of overall health disparities. So we continue to do all of the same work of outreaching those harder to reach groups.
And I'll just add that to what Dr. D is saying. The most important thing is that we're going to continue to take the vaccine to the communities, to the people, directly to them. And it's been something that has worked great with our mobile vaccinations, with our seniors, and the homebound work that they've done. And now we have to take it up a notch. Alexa?
Regarding the mask mandate, we've heard from some retail shop owners getting some pushback, specifically over the weekend following the governor lifting it, the CDC recommendation, getting a lot of pushback from customers about having to wear a mask indoors. Do you feel this difference is putting these employees in danger? Could you speak to that?
Well, what I'd say, Alexa, is one, we, of course, are always going to be concerned about people who just don't think they should follow the rules. And we know, we've seen this thing with folks not having to wear masks throughout the entirety of COVID. This is nothing new, and what we will do is make sure that we're there to support people as we go through this. But we can get to a point where we don't have that. The Dr. D has laid that out very quickly, that once we get to that point, we'll be able to remove that. We'll make sure that the police and other agencies are there to support, but we'll also have to, again, remind ourselves that this is not over.
My second question is for the commissioner, actually,
Go
if
ahead.
I could ask him. Is there an ETA on when the body-worn camera footage will be released in either of the officer-involved shootings? Why hasn't that footage yet been released?
First of all, thank you. And there's not an ETA, but at each of the incidents, we had an opportunity to watch the video, and we enacted our body cam video critical incident policy. And the policy itself, once we enact the policy, I believe the policy allows for 7 days, because there is a lot of consultation we do with our city attorney, our state's attorney, our U.S. attorney, the head of public integrity, and their socialization of that perhaps with the family members. And so while it's not an ETA, we anticipate that it will be likely this week.
That 7 days you feel is
I have 7 days
accurate?
I have by policy 7 days to make the decision or give justification why I didn't. I've decided that we will release it. It will likely be toward the middle of the week.
Mr. Mayor, I wanted to ask you actually about the security deposit alternatives bill. Do you plan to veto that bill with the deadline coming up? And if so, do you think that you have the support from the council to sustain a veto? And we've also heard that you desired some amendments, and if you'd be willing to lay those out, that would be great as well.
Well, listen, we know that security deposits have been a barrier for renters and residents, especially those coming from low income and families, and we have to address that. And every decision that I make is rooted in equity and also undergoes very careful and thoughtful consideration. I don't do anything by the seat of my pants, and this legislation is no different. My team and I have heard all of the concerns from the advocacy groups, but also directly from citizens, and been in constant contact with the vice president of the council who sponsored the legislation. And in my 10 years in elected office, and even longer when you consider my time as a staffer in city government, I've never seen a perfect bill. And I personally, to your point, would love if this legislation offered tenants the option of an installment plan and required landlords to offer a security deposit insurance, to also offering multiple products from multiple companies rather than just the one. And moreover, I think it's important that we should include more protections against fraudulent claims if tenants accept the security deposit insurance option and require a mandate for tenant education on the security deposit options as available to tenants. These are just a few items that my team and I would have liked to see in the legislation, but I assure you, I will make the best decision before the end of the day at the proper time for Baltimore.
Sure, a lot of the concerns about that bill have been that the insurance mentioned doesn't quite function the same way as insurance does, and that may confuse renters, and so, have you thought about, you discussed with the council vice president, what's on the table in terms of
Well,
addressing that?
I've just laid out for you what I would like to see in the bill, and those are the ways that I think that those concerns can be addressed.
Thank you.
Thank you. Okay? I almost didn't see you back there.
Hi.
How are you?
Good, how are you, Mayor?
I'm doing all right.
A question and a clarification about the percentage of the threshold you want to meet before
65.
lifting the mask mandate. Currently 42% you said of adult residents have had at least one shot. Given the influx of supply now, it's not fair to compare how long it took to get here to how long it'll take to get to 65. So I'm wondering if you have any kind of idea the way things are going, the timeline for that. And I just want you to clarify, is it 18 and older that you're looking at, or is it over 18?
It is 18 and over, since we know that the vaccines, there's only a small amount of vaccines approved for children between 12 to 15, and then Pfizer for 16 and up. So we are using 18 and up, and that data is also readily available on the CDC's website as well as ours. That's the metric that the state uses. So the state on Friday, when they lifted the indoor mask mandate, we're at 65.6%. So again, this closely aligns with what the state metric was when they lifted the indoor mask mandate. So we are looking at adults. I think, again, it continues to be a work in progress. So we obviously have a couple of mass vaccination sites in their city, but really the approach will be in the months to come around mobile vaccination sites and pop-up clinics that are easily accessible all across the city to just provide that equitable access. So as we're planning for mobile and pop-ups, we're looking at areas with low vaccination coverage, and those will be the locations that we go to first.
Is it, I may follow up, is it safe to say you can't give an exact timeline, but you hope it'll be quicker than it took to get to this?
Yeah, no, I mean, I hope it will be quicker. Again, I can't stress enough, vaccine is readily available. So I would encourage anyone who has not yet been vaccinated to get vaccinated now, because there is vaccine available. But no, I don't know that I necessarily have a timeline.
Thanks. And may I ask one more COVID-related health question? I don't know if you can answer this, but I've been wondering this. Have you seen, as you've seen an increase in the vaccination rate in the city, have you seen a correlating decrease in the COVID testing numbers? And if so, do you believe that might be having any sort of an impact on the data in a positive or negative way?
Yeah, that's a great question, and we do look at that pretty consistently. Our testing levels have actually remained relatively steady, so we've seen them decrease certainly across the state and across the country. We have been relatively steady with the amount of tests we're able to offer, usually averaging around 5,500 to 5,600 tests per day is what we see being performed throughout the city. Now, we're cognizant that we also have universities in the city that do testing, so we will continue to watch the data as we know that schools will be closing.
And I would just say before we close that in order for us to get to that 65% quicker, folks need to get vaccinated. So if you want that mask mandate to go away, get vaccinated. And we must continue to still get tested. I myself got tested this morning because it's the right thing to do, not to just protect myself, but to protect everyone else. Thank you, everybody.